Recording in progress.
Okay, good afternoon, everyone. We'll go ahead and get the meeting started. Susie, can you get the roll call, please?
Yes, Chair. Excuse me, Chair Delgado,
Here.
Vice Chair Lucy,
Here.
Michael Brown,
Here.
Councilman Dare,
Here.
Dr. Danko will be absent, Dr. Novak will be absent, Dr. Klocking is absent. Chair, we have a quorum.
Thank you, Susie. Appreciate it. Let's have a Pledge of Allegiance. Rayona Dixon, can you lead us in the pledge? To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Right. Thank you. All right, District Health Officer, do we have any changes to the agenda?
I do not believe that we I'm not seeing presentation from. Oh, here it is right here. Okay. Yes.
We're good?
That's perfect.
Okay, no changes on the agenda. Can I have a motion, please?
Motion to approve.
Second.
Motion and second, all in favor?
Thank you, Chair Delgado. It's my pleasure to introduce Dr. Muge Akpinar, the Dean of the School of Public Health at UNR, along with Gabrielle Brackett, who's the Director of the School of Public Health Development Program, and they are going to provide us with an update on the Washoe County District Board of Health Scholarship and Recipients.
You have a clicker at the podium to advance your. Perfect. Just check it.
Oh. Having some technical difficulties. I'm not sure it's working.
Can you?
Oh, there we go. Okay, sorry, everyone. Good afternoon. Thank you so much for the opportunity to share, and special thank you to the Washoe County District Board of Health for your partnership and support of the School of Public Health. As you announced, my name is Gabrielle Brackett, and I am the new Development Officer for the school, and I have with me Dean Muge Akpinar Elsie, and we are just here to provide some information about our Board 2022-23 Scholarship Recipient, provide a very brief endowment overview, and then share a quick update about the school. Unfortunately, our scholarship recipient could not be in attendance today, but his name is Nathan Turner. He is a native Nevadan and third-year kinesiology student. He serves the community by volunteering with Veterans Guest House and serving as a youth ministry member. He also works as a technician for Reno Sport and Spine Institute, and he plans to attend physical therapy school after he graduates. He asked me to express his heartfelt gratitude for being the scholarship recipient, as the scholarship helps him to alleviate the stress that comes with paying for school. So thank you so much for your support and for this endowment. A brief endowment update. As you can see, the market value of the endowment did increase from 2020 to 2021, and this is really attributed to some additional gifts to the endowment, to the endowment's principal that we did receive. So with that, the current payout generated for the 2022-23 academic year is $994. So thank you again for your support of our upcoming public health professionals. And with that, I will pass it over to Dean Akpinar.
Thank you very much again. And just very quickly, some updates from the School of Public Health. Currently, we have 2,000 undergraduate students in the public health program, and we have 300 graduate students. And it's an important number. I guess 80% of our graduates stay locally, so they are in the state. So we are very proud of that part. Currently, we have 2 undergraduate programs, including the public health and the kinesiology, and we have 4 master programs, including MPH, MS in Biostat, and MS in kinesiology, which is very important for our state because it's the data analysis is getting important, and so Biostat students, we are really hopeful that they will help that request, data informatic risk request, and the kinesiology also is hopefully moved to later on the physical therapy and the OT program, so that is a huge need in the state again. And we have very strong research programs. Our research funding is increasing, connecting with the community-based research specifically, but also we have all kind of students opportunities with the global initiatives and again, research. But I want to repeat our certificate programs because these certificate programs specifically develop for the workforce development. So we are really hoping the practitioners in the field, they can also benefit from that programs. We got our accreditation last summer, so we are coming to our first year, completing our first year. We have very strong faculty body, and UNR is really supportive to growth of the public health programs under us, so we are very fortunate that part. And also our alumni association, we just created the Public Health Alumni Association last year, so I know that couple are alumni here. If they can be member, it will be great for us also. As a vision as a future, we are really focusing to how we can be innovative solution we can find for the health impact of our communities, and especially connecting with the diversity and inclusion. And we really want to increase our national reputation. So for that purposes, we need to really support our local communities, and this is very key for us. So I guess that's it. Thank you very much again, your time. Thank you.
District Health Officer.
Yes, thank you, Chair. I just wanted to remind the board and acknowledge that we are an academic health department with the agreement that the board approved, I believe it was last June, with UNR School of Public Health. And so it's also great to see the value of the endowment growing over the years.
We also thank you for your support for the 3 years.
Thank you so much for the presentation. Any further comment from the board? See none. Outstanding job. Thank you so much. I just appreciate also just hearing all of our graduates staying home and giving back. And none show that as much as these last several years, the importance of public health. So thank you. District Health Officer, next item.
Our next item is for recognitions, and I'd like to begin years of service. We have Erin Dixon, who has 20 years of service, and where Erin's waving, stand up, and then if you stick around, we'll take pictures, and I have a certificate for you. Erin, as everybody knows, is our Environmental Health Services Division Director, so thank you, Erin. And then Maricela Caballero has 25 years of service. Maricela, if you could please stand up.
She's not here today.
Oh, she's not here, okay. Thought she was going to make it. She's working hard as a Human Services Support Specialist in CCHS. And we have a number of new hires today. And I'd like to ask Lisa Lotritz if she could begin with introductions of her new staff members, and perhaps if those staff members could join her up in front. We have Monica Pearl Simard, Jasmine Alvarez, and Daisy Rodriguez. Yeah, we have also a recognition, so why don't you go ahead and recognize Kayla Solario as well?
All right. Good afternoon, Lisa Lottridge, Division Director for Community and Clinical Health Services. I'll start with Pearl Samard. She is our new public health nurse in immunizations. Pearl has extensive experience in community health outreach and most recently worked as an emergency department nurse. She's grateful to bring her experience to the county to help our community. And she recently came to Nevada after working 8 years as a nurse in Hawaii. So glad to have Pearl.
Of course.
Jasmine Alvarez is our new community health worker. These all 3 community health workers. She was previously working as a case manager with Wraparound Nevada, assisting children with mental health challenges and their families. She brings a wealth of community resources and knowledge.
Awesome.
And Daisy Rodriguez, another community health worker, comes to us from Renown, where she worked as a community health worker. Daisy's knowledge and experience as a community health worker will be an excellent asset as we integrate community health workers into our programs. And then last but not least, Kayla Solaro, she's under promotions. She was an internal promotion. She previously was a community health aide in family planning, sexual health, and was promoted to a community health worker. And she has so much enthusiasm for outreach and helping our community. We're excited to have her join this team.
Awesome.
Right.
Thank you, guys. Thank you.
All right. And we have also a new hire in EHS, and Ms. Dixon, if you could introduce Ian Chuck to us, and if you would like, we could also recognize Byron Collins at the same time, as long as he's standing up.
Thank you so much. Good afternoon. Can you hear me?
Thank you.
I'm excited to introduce Ian Check. Ian comes to the Health District with a bachelor's degree in community health sciences from the University of Nevada, Reno. His previous experience included working as a disease investigator for the Health District's COVID unit. And then most recently, a teacher at Sparks High School.
Nice.
So we are very excited to have him join our team and absolutely know his experience will make him a great asset to EHS. In addition, I'd like to recognize Byron Collins. He was recently promoted from an environmental health specialist to a senior registered environmental health specialist. He oversees or leads our building plan review. He has been with that program for 14 years.
Wow.
And brings a wealth of knowledge and good leadership skills to that program.
Awesome. Welcome. Congratulations. Go Railroaders.
All right. And then we also have several new positions in the Office of District Health Officer's Office. And I'd like to ask Julia Ratty to introduce the new staff. If they could come down as well. We have Ava Leon. I guess we have two of Ava and Camille Haga. And we also have a new staff member, Isiana Montoya Adam, who's not present today.
Might be on Zoom.
Might be Zooming. Go ahead, please provide introductions.
Hello, members of the board. Good to see you today. I am very excited to introduce 3 new hires in the Office of the District Health Officer who all started on Monday. First, I'd like to start with Camille Haga. Camille is our new program coordinator. She'll be working with Rihanna Lavoie on the team that does all of the work to make sure that we maintain our accreditation here at the Health District, including strategic planning, workforce development, our CHIP and our CHA, all of those wonderful projects. Camille comes to us actually from the university environment. She's relocated here from relatively recently from Idaho and has significant management experience. She has had a very impressive resume, having started on the ground floor and rapidly moved up to running programs specifically serving people with disabilities. Probably my favorite thing from the interview is that she taught herself Braille.
Wow.
And then on my left-hand side, I have Eva Leon. Eva has a significant amount of experience in the public health setting, specifically in a clinic environment at a particular organization that I might need to remain unnamed. It just happens to be the Community Health Alliance. She has tremendous experience, again, in that community setting and serving diverse populations. And she is one of our community organizers, one of the positions that we were able to hire from the CDC Health Equity Grant. And then the third individual who may or may not be on Zoom is Itziana Montoya. She is the second community organizer. And she comes to us with an extensive background in community organizing and community outreach. Her most recent position was with Women and Children Services of the Sierra, where again, she's doing some tremendous work with populations that really need our assistance. So with these hires, that fully builds out the Public Health Accreditation team and all of the 7 positions on the CDC Health Equity Grant, and we are very excited to hit the ground running. Thank you.
Wow. Congratulations, Eva. I'm glad you're here. We miss you already at CHI. Congratulations.
And I can share with the chair that I saw Ann Corey, your foundation person, yesterday, and she gave me a hard time for Health
taking
District
people.
hiring CHA staff.
It's a great organization. Congratulations again.
Next, I'd like to move to our retirements and recognition of Janet Smith, who retired from Air Quality Management as Administrative Secretary. And Janet, thank you for standing. That was the end of, she ended up working there through other areas of the Health District, the end of her illustrious career with the Health District. She was a county employee at the Health District from October of 1993 through March 11th of 2022. But that 23-year period is only a portion of her career with the Health District, because she also served with us, I believe, 15 years as a temporary
15 and a half.
staff. So 43, 44, 45 years with the Health District total, however those numbers add up. So thank you so much for your service, Janet. And we have a clock, small token of our appreciation for you. It says Washoe County Health District recognizes Janet Smith for 28 plus years of dedicated service of October 18th, 1993 through March 11th of 2022. But as I said, only a portion of that time formally as a Washoe County employee at the Washoe County Health District. So if you could stick around, Janet, with everybody else, we'll move through, I think, the proclamations and then take pictures. Great.
Thank you, Janet.
Congratulations on your retirement. We also have special recognition that we wanted to have for our Health District staff, and we have many of them that have worked on our COVID-19 response. And we had a little celebration for them earlier this week and recognized them with challenge coins for their service. But I think it's just incredible the way our staff pivoted when we had the pandemic hit us and moved out of their normal program areas to provide the staffing that we needed to do all kinds of mission that the Health District is not normally doing, from standing up to do the mass testing program, setting up a call center, the disease investigation and contact tracing work, all of the logistics behind all of that, and designing all of the processes that were involved in getting over 90,000 people tested, over 210,000 people, or over 210,000 vaccines administered. We did stab some of those people multiple times, but the amount of work that went into it and planning and logistics, I think, was incredible, and a tribute to the great staff that we have and their efforts to work to continuously improve what we were doing day to day in that COVID response. So just heartfelt gratitude to all of our staff for the work they did, their personal sacrifices, and the sacrifices of their families. And it's quite a list.
And as the list goes on, District Health Officer, I just again want to give my thanks. The situations that the community was in many different ways still undergoing. Can't say enough about how appreciative I am to the whole organization. I mean, volunteers included, but for us to have stepped up the way we did, as quickly as we did, and in creative and innovative fashion, it just warms my heart and blows me away about how proud I am of who we are and the amount of work we can do. It goes without saying that I know they're tired, but excited. But again, we were a model not only in our community and in our state, but across the nation. And I thank so much our staff and our team. Your involvement saved lives, changed lives for the better. And so thank you so much for sticking with us, but using that enthusiasm and change as we move forward to be better for the future. So thank you. Yes, Councilman Dare.
Yeah, I had the honor of, during even that time, being around the state, and even sometimes in other states, and I just got to say, what we were able to accomplish together was pretty amazing, and did shine, and then especially what, we've never been through anything of that fashion, obviously, but watching people step up, even though, there was even a lot of adversity, it would seem, during that time. Well, not just it would seem, there was a lot of adversity during that time as well. And so watching people come and stand up for what's, it's right, and helping and being there, it's amazing. And hopefully in our lifetime we don't have to do that again, but it is a very good thing to know that we have a team ready to do what needs to be done.
Thank you. Further comments? No? I know we have one more item on here.
Yes, we have the Washoe County Health Heroes recognitions, and so this is our new recognition program through the Health District that was developed by a staff committee and it's focused around the values that we have at the Health District. And so I wanted to begin, we've got kind of two tiers to the recognitions, and the first is for those that their nomination recognized how they supported the values of the Health District. And then there are another tier of individuals that were recognized, but the nominations did not point and so much to the values for the Health District, but otherwise their performance. So as far as the value recipients, we have Christabel Sotella Zakena, who's was recognized for partnership and collaboration. And Christabel, if you could please stand. So thank you for your work at the Health District and how you've supported those values. We also have Narcy Perez Zapata, who is in the back corner. Thank you, Marcy, for professionalism, partnership, and collaboration. Teresa Long is not able to join us today. She was recognized for trustworthiness and collaboration. We have Amanda Santos for partnership and collaboration. That was recognized. Thank you, Amanda. Christina Shepard with CCHS for partnership and collaboration. So thank you. Lisa Wilson with CCHS for trustworthiness and professionalism. So thank you, Lisa. And then we have honorable mentions for their nominations. Mike White, EHS. Shayna De Silva, EPHP. I'm not sure if Shayna's here. Karen Frazier, EPHP. Daisy Lara, EPHP, and Maribeth Mashad with CCHS. So I want to thank all of those staff for their work and their recognition by other employees or customers for their service. And then We have a couple of proclamations as our next item, if you want me to move forward with that, and then we could maybe...
Can we just give a round of applause to all those recognized today? So many recognitions. Thank you. Thank you. Yeah, I believe we have proclamations and for pictures right afterwards, so please don't go away. So,
Okay.
District Health Officer.
So I'd like to begin with the proclamation for Washoe County Air Quality Awareness Week, and I believe Francisco Vega is going to accept this. Whereas poor air quality can threaten the health of our citizens and visitors, and whereas the increasing intensity, duration, and scale of wildfires has negatively impacted air quality in the western United States, and whereas children, older adults, and people with heart or lung disease tend to be more vulnerable to air pollution, and whereas the Washoe County Health District Air Quality Management Division is responsible for managing sources of air pollution and assuring compliance with federal, state, and local laws governing air quality, and whereas the Washoe County Air Quality Trends Report, which contains information such as national ambient air quality standards, local ambient air monitoring network, and current air quality design values and attainment status, is available at ourcleanair.com. And whereas AQMD implements clean air solutions that protect the quality of life for the citizens of Washoe County through community partnerships, air monitoring, permitting and enforcement, planning, and public education. And whereas clean air will require a collaborative effort by all stakeholders in the region. Now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim the week of May 2nd through 6th, 2022 to be Washoe County Air Quality Awareness Week in Washoe County, Nevada, and encourages community action to reduce air pollution levels during this week and throughout this year. Adopted this 28th day of April 2022, Oscar Delgado, Chair, Washoe County District Board of Health. Let's see. That's this one.
Thank you.
Did you want to make any comments?
Francisco Vega for the record, Division Director, Air Quality Management Division. As stated in the proclamation, air quality has a tremendous impact in the health, welfare, and quality of life for the residents of Washoe County. With that understanding, we at the Air Quality Management Division look forward to working with our regional partners, elected officials, and community organizations to improve the air quality in Washoe County.
Thank you.
Thank you.
All right. Next, we have the National Bike Month and Bicycle Safety Month and Washoe County Bike Month proclamation. And is Yen Ling Barnes? Oh, Stephanie Chen is doing this. I'm sorry. Whereas promoting alternative forms of transportation such as bicycling helps to improve the health and well-being while reducing emissions, traffic congestion, and America's dependence on fossil fuels. And whereas creating bicycle-friendly communities has shown to improve quality of life by fostering community spirit, improving traffic safety, and stimulating economic growth. And whereas bicycle infrastructure in the Truckee Meadows offers great potential and opportunities to positively impact our recreation and tourism industry by making the region attractive to residents, visitors, and new incoming businesses who enjoy healthy lifestyles and the outdoors. And whereas Nevadans will experience the joys and benefits of bicycling during the month of May through educational and safety programs, community events, or going for an individual or group bike rides. And whereas the education of our entire community on the proper and safe operation of motor vehicles and bicycles sharing the use of streets is important to ensure the safety and respect of all users on Nevada roadways. And whereas the month of May has been declared National Bike Month since 1956, now therefore be it resolved that the Washoe County District Board of Health does hereby proclaim the month of May 2022 as National Bike Month and Bicycle Safety Month in Washoe County, Nevada, and Washoe County Bike Month, adopted this 28th day of April 2022. Oscar Delgado, Chair, Washoe County District Board of Health.
Good afternoon, members of the board. On behalf of the Truckee Meadows Bicycle Alliance Group and the Bike Month Planning Group, we want to remind everyone that May is Bike Month, and this year we've actually expanded Bike Month to include all multimodal transportation. So for the month of May, we are encouraging the community to replace some of their car trips with active transportation to include cycling, walking, or skating. And for more information, you can visit bikewashoe.org. Thank you.
Thank you.
I just wanted to know, Chair, if Kevin's going to ride his skates to work this month. I want a commitment out of you, sir.
I don't have knee pads, so I don't think I'll be riding skates, but a bike's a possibility for me.
Awesome. Thank you, District Health Officer. If the board wouldn't mind coming down, we'll take a few pictures.
Perfect.
Yeah, do we got to take a motion on all these? Yes, please.
Motion to approve.
Motion second. Any further comment? None. All in support?
Aye.
Any motion carries? Thank you.
When you get up and look.
Show off your certificate, nurse. Where's your certificate? Yeah, she's Narcy. You have the. Yeah, for the heroes.
That's real gold on there.
She has a certificate. No. I think you got yours on email. I think you got yours on email. Yeah. No.
Did you want the proclamation?
Oh, yeah, we should do proclamation pictures too.
You look all photogenic and everything. No.
Okay, that closes item number 6. Again, congratulations to all those recognized who received awards today, and welcome to all those that have joined that magnificent team. Moving on to item 7, public comment. Susie, do we have any public comment?
We do not have any registered public comment.
We'll close item 7, public comment. Move on to item 8, COVID-19 updating information. District Health Officer, do we have any updates?
Yes, thank you, Chair Delgado. I'm pleased to report that our COVID-19 situation remains pretty good. Our community level for COVID impact with the CDC criteria is at low. We reported 23.7 new cases per day for our 7-day average this past week, which is up from about 16.7 the week before. So it is an increase. We have seen some increases in wastewater concentrations, but still at the low level. And we kind of anticipate we'd see a little bit of a bump as we've gotten BA2 now, is now the primary variant showing up as 99% of the COVID that they're finding is the BA2 variant in the wastewater samples. But the numbers are remaining low, and with these low numbers, we would expect them to be fluctuating around in some range. So we're watching that. Hospitalizations still remain good. Yesterday, the Hospital Association reported their 7-day average for Washoe County at 10 people hospitalized for confirmed COVID-19. That's less than 1% of the hospital burden is COVID patients. So all still good on that front. We're continuing to provide vaccinations. We were at Earth Day on Sunday, Bartley Ranch Tuesday of this week. We'll be up at Incline at the hospital there on Tuesday next week, as well as Reed High School that afternoon, at the Neal Road Recreational Center on the Wednesday for a family health festival, where we'll be providing vaccinations, at the Convention Center Thursday, at Reno Little Theater on Friday and Saturday nights, and also on Saturday morning at the Senior Center as part of our Hello Project. So still doing a lot of community-based vaccination events. Vaccinations are available all weekdays through our clinic operations. Countywide administered about 3,300 vaccinations through all providers last week. About 85% of those are booster doses that are being administered, and most of those are second boosters. We've, of the 12 and older population that are fully vaccinated, 44.7 of them, 7% have been boosted. And in that over 65-year-old age group, about 65.5% have received their booster doses. But our continuing outreach and communication is on the for people to get that booster dose to enhance their protection. We're at overall the 5 and older population in Washoe County, almost 75%, 74.8% have initiated vaccinations, and 65.6% have completed that initial series for their vaccinations. And there was a study that just came out on Tuesday of this week that CDC published in their mortality morbidity weekly review. And that was looking at seroprevalence of the percentage of people that showed through antibodies that are only produced by infection, they're not produced by the vaccine. The percentage of people that have been exposed and infected with COVID-19. And they did this looking across the nation at commercial labs and samples, blood samples that had been collected. And they saw a dramatic increase in the number, let me see if I can find, here we go. In the percentage of the population that had been infected, really jumping from December of 21 through February of 22. So the overall percentage of our population that's been infected is now close to 60% at 57.7%. But that jumped over that 3-month period up to that level from 33.5%. So a huge number of people that were infected with the Omicron surge. Of the 0 to 17-year-old population, about 75% of those children showed that they had been infected. And as you look at different age brackets moving up from there, the percentage that have been infected decrease down to age 65 and older. 33.2% have been infected. And so I think it's interesting in looking at those figures that also kind of reflects the protection of vaccinations. If the older population and much more of that population is vaccinated, under 5 aren't eligible for vaccinations, and the lowest percentage of vaccinations are in that under 17-year-old age group where we saw most of those infections. So with those recent infections happening from the Omicron surge and the at least short-term immunity that follows that, as well as the percentage of the population that's vaccinated, that would indicate that we're actually in a pretty good situation as far as immunity in our community moving forward. So I thought it was a real interesting study to see that. Now we know that infection-derived immunity is probably not going to last like the vaccine-acquired immunity. So could be some change over time with those. So people are still encouraged to get vaccinated and get boosted for those protections moving forward. And then we have readily available therapeutics so that if people are tested positive and they're older or at high risk of severe COVID-19. They can get the antiviral pills, the monoclonal antibody treatments. We have 4 local pharmacies, CVS, that are in the federal test and treat program, where people can be tested for COVID-19 and get a prescription for the antiviral, the Paxlovid, if they test positive. And we have about 50 pharmacies and healthcare providers that are dispensing the therapeutics across our community. So we're in kind of a new situation with a number of people that have immunity, the widespread at-home test kit availability, the widespread availability of the treatments. So that's my update for COVID-19.
Thank you.
Chair,
Councilman.
for the record, I just wanted to let you know, Dr. Clacking signed on via Zoom at 1:42 p.m.
Good to see you, Dr. Clacken. Councilman Dare.
Is there any reason that we still say, you just said for older people with the antiviral or people who are susceptible or whatever, why do we not just have a medicine ready for antiviral for people? I mean, we have seen it tick down. We can ramp up and have all of these other things made. Why are we having such a struggle here? And how do we do something about that? Because if there's a sickness out there, let's just have a cure ready for someone if they're sick.
Yeah, those are the guidelines that are put out by FDA and CDC for the use of these at this point. So I'm not sure I have an easy answer for you as to how that gets changed. I think the initial thought was that the supply is limited and that we needed to be careful with that. But I think the situation is that it's not being widely prescribed by our medical community. And that's why we seem to have so much available. We've got the low number of cases, obviously, but I don't think there's been the demand that had been anticipated for it. And that may be part of it, people not knowing for sure whether they can get it or not.
How about for us? Do we have to be stuck that we only help our senior population? What if we have extra medicine, someone's sick, why can't we give them medicine?
Well, I don't have any authority over how that's prescribed.
So I'm saying, you're saying we make that decision based upon what happens in DC? They make a decision and we're following
and
that?
that's what the state is following, yes.
So how do we try to say we don't like that? Because that doesn't make any sense to me.
I just heard you say that. I don't know what if the board could do a resolution if they chose to do that. I can communicate to the state, what I've heard from you.
Thank you. I'd like that. I'd like feedback. I mean, I'm at this point. I don't know if I'm throwing a stick of dynamite or just a rock, but let's throw a rock at the window and see why are we doing this, and then let's at least get some feedback. If we have sick people and we have medicine, we should be using it. And I get what they said before because we were concerned to make sure we had enough. But at this point, we're not in that we're not in that place, so it doesn't make any sense. Thank you.
Yep.
I had a quick question, real quick there.
Yes, Dr. Clacken.
So I understand that on the Paxlovid, are you saying that we do have plenty of supply in Washoe County now of it?
It appears that we do. It's available through multiple organizations, and there's been some more communication both at the federal level and from the state, advisories about, we do have this, it's available and prescribe it for these populations. So I think the effort right now seems to be in trying to promote, let's use it for those people that are, more at risk from COVID-19. But as we just heard from Councilman Darrow, there's a desire that be expanded to promote it for more people to be able to access it.
Yeah, I think the last time we talked, you had mentioned that you didn't expect the levels to be high enough levels in being Paxlovid, the amount of it available until about July. So it looks like we have a good enough supply now.
Yeah, I think it's something like just under about 1,000 courses of treatment that are provided to the state weekly, and that's statewide. And so that is a limited number, but if people are not accessing, seeking to access it, then that ends up staying on shelves.
Okay, does that stop our 1,000 from coming in the next week, or does it build up over time then?
That's building up over time.
Mm-hmm. Good.
Good, great comments. Any further comments from the board? Seeing none, we'll close item 8. Move on to item 9, consent items. Susie, do we have any public comment on consent?
No registered public comment, Chair.
None registered. Does the board want to pull any items from consent? Can I have a motion, please?
Second.
A motion, a second. All in favor?
Aye.
Any opposed? Motion carries unanimously. Move on to item 10, Regional Emergency Medical Services Authority, otherwise known as REMSA. We get the Mr. Famous President CEO, Dean Dow, with us. Welcome. 10A, Review and Acceptance of REMSA Operation Report.
Good afternoon, Board Chair and members of the board. My name is Dean Dow, President and CEO of REMSA Health and CareFlight. You have before you our monthly report. Happy to answer any questions I can relative to that. I would also like to add, following up on one action item from the board's request from a month ago, we did have a Joint Advisory Committee meeting on April the 13th, which was Wednesday, so roughly 2 weeks ago. Very well attended here at the county complex. So all fire partners were there, obviously our organization. And the discussion centered around the ability to continue on with patient guidance programs, and also with the tiered system. So the meeting was roughly, I believe, if I remember correctly, about an hour and a half. Very good conversation. I think we are trying to reschedule or schedule a second meeting to sort of condense the conversations and make recommendations. So we'll be getting back with the board on when that meeting will be set to take place.
Thank you, sir. Any comments from the board? Councilman?
I just wondered on an update on how staffing going and things. I think you're seeing a recovery of people coming back to work because of whatever. We still hurting. I mean, it's not, obviously it's everywhere. We're not just saying you, but how's that going? What's going on?
Well, I think we're suffering in the same situation that all of healthcare is suffering from right now. I think the pre-hospital care systems, and this is inclusive of, I think organizations like ours, the fire service, communication centers, so 911 centers, even the hospitals, as you know, we're still way behind, all of us, on the ability to hire. Talking with our HR director, maybe a little bit of a glimmer, Councilman Dare, that we're, there's more interest, we're getting more contacts, if you will, maybe over the last few weeks, but that's probably too early to really be definitive.
How many would make you whole?
How many people right
how
now
many
would make us?
would make us whole, in a sense? Do we know that?
We have a class that starts the first week of May that has, I believe, 14 people in it. After that, I would predict we're probably in the zone of about another 15 people or so, give or take one or two.
Okay, thank you.
Thank you. Any further comments? Seeing none. Any public comment on 10A?
No public comment.
Zach, can I have a motion?
Motion to accept.
Second.
A motion and a second. All in favor?
Aye.
Any opposed? Motion carries. Item 10B, Mr. Dean Dow.
Dean Dow, President and Chairman, President and CEO of REMSA Health and CareFlight. I'm standing in place of Alexia Jobson today. Alexia, along with several of our executive team, are right now at Navigator, which is a national 911 communications conference being held in Nashville, Tennessee. So many of our folks are being recognized, our centers are being recognized there this year. And then all of our attendees are also speaking at several times during the conference. So from Alexia, just a few updates. The Reno Aces, now that they've had their opening day, We have a 30-second explainer video up on their system that speaks to the right levels of care and how to choose the right levels of care and when you're calling 911. And also, we have an ongoing public awareness campaign, as I think she spoke to last month, again, sort of identifying proper utilization of the 911 services and levels of care. There is going to be a new part of that kicks off at the end of this month. So I think in just the next day or two here locally with KRNV. Additionally, starting next month, the RTC buses will be featuring interior ads in English and Spanish that also not only address the 911 utilization issue, but also assess and refer messaging for the community. And then finally, at the beginning of next month, representatives from RMSA Health and the Regional Communications Center will be participating in the Nevada Donor Network press conference that I believe is going to be at the Washoe County Sheriff's Office.
Awesome. Thank you. Is there any questions?
So I didn't do as good a job as she usually does, but I tried.
Any comments from the board? See none. Let's accept the report. Thank you,
Okay,
Mr.
thank
Dow.
you.
Appreciate it. Mr. Dow, if you could thank your board and your team. Appreciate the amount of work that they're providing in terms of communications with questions that were asked of the board last month. Appreciate that, the support. Thank you. Thank you, thank you. With that, we'll close item 10B and we'll move on to item 11. Presentation, possible action on the CHIP. Riona, come on down.
I have to bring that way down. All right. Good afternoon, members of the board. My name is Riona Lavoie, and I'm a management analyst here with the Washoe County Health District. Today, I'm going to be providing a summary of our 2021 Community Health Improvement Plan Annual Report. As I move through the presentation today, I'll be referring to our improvement plan as the CHIP. The CHIP is a community-driven improvement plan. However, the Washoe County Health District is charged with tracking all of the activities that are within the CHIP. We're also charged with tracking all of the data and collecting the data, and we are charged with preparing the annual report. The annual report highlights all of our accomplishments that we've made with our partners in the last year. And in the later half of my presentation, I'll also talk about what's on the horizon. The 2021 CHIP had 3 focus areas. We continued to focus on housing and homelessness, behavioral health, and physical activity and nutrition. The pie chart that you see on the slide is a visual representation of the objectives that were achieved this last year. In total, we had 30 objectives, and we had 65 action-oriented strategies that corresponded with each focus area. But really, these strategies detailed how the Washoe County Health District and our community partners would work together to accomplish those larger goals. To accomplish what's in the plan, most of the initiatives have smaller subcommittees that met on a regular basis. Some of those are still underway, but as you can tell here from this pie chart, most of what we set out to accomplish has been completed. And like I said, most of that work too is also underway. So for today, I'm going to hit the highlights. However, in the actual report that'll be available online, you can go to each strategy to find out more details on the progress that we made alongside our partners. So our first focus area is housing and homelessness. 8 out of the 13 strategies were completed. In an effort to improve the quality of care and connect more individuals to the right resources, our housing partners set out to establish case management ratios that mirrored the national best practice standards. The intensity of supports do vary depending on an individual's circumstances, so those partners have different caseloads, and so their ratios are a little bit different. But as you can imagine, providing quality case management services is a critical component to ensuring that our individuals have positive outcomes. In 2021, the Washoe County Health District provided funds to the Eddy House to expand their outreach. These individuals, and we are hoping that they'd be able to engage more youth served through their community-based living program. And this program targets bringing youth out of crisis and into stable housing. So with funding, they were able to expand their outreach to reach individuals frequenting the motels, as well as those who are at the Washoe County Jan Evans Justice Center. In the last year, they were able to reach over 300 individuals. 18% of those individuals had an increase in employment, and 8 of those individuals were transitioned into stable housing. Our second focus area is behavioral health. I'm going to start with the Signs of Suicide program because significant progress has been made over the last year. The SOS program is a prevention program that educates students about the relationship between depression and suicide. And this program is being implemented throughout middle schools in Washoe County. In 2019 and in 2020, this was an opt-in program that required a consent form that would be taken home by the students to get signed by their parent or their guardian, and then they would bring that form back so that they could participate in the program. So this caused several barriers to students engaging in this program. However, in 2021, the program is now an opt-out program where parents receive the information about the program during student enrollment, and at that time, the parents have the option to opt out. So in 2021, over 4,000 seventh grade students received the SOS education, and of those students, about 1,500 were screened as needing additional services to address at-risk factors for depression or suicide. The number screened is an increase of about 255% from 2020. The health district also the health district also provided funds to CASAT to expand the PRSS workforce. And PRSS stands for Peer Recovery Support Specialist. And this specialized workforce is extremely important because these individuals have lived experience of a behavioral health challenge or a substance abuse challenge, but they've gone through recovery and are dedicating time to be trained to help those who are also experiencing a similar challenge. CASAT has engaged and is training over 40 individuals so that they can prepare to take their board exam to become a PRSS Nevada certified specialist. Of these individuals, 12 new individuals have passed the PRSS Nevada certification board, and several of those individuals have been hired in the behavioral health field, or they've received an increase in pay now that they're state certified. So that's great. We are also providing supports to the Living Ideation Program, and this is a partnership between the Children's Cabinet, Quest Counseling, and the Washoe County School District. And this program is targeting teachers and parents as well as high school students, but the program focuses on normalizing youth mental health challenges and is also preparing teachers and adults and parents on how to identify signs of a mental health challenge if their student is experiencing one. Outreach events have been provided throughout Washoe County high schools, and 7 high schools are supporting school-based support groups that are engaging students so that they can learn about normalizing stress responses like anxiety and depression. We also have the Washoe County Behavioral Health Crisis Response System. A lot of you guys have heard the report during the mid-year progress report that was provided a couple months ago. But partners have made significant progress to improve the crisis response system to better improve support for individuals experiencing a behavioral health crisis. One initiative that you might already know about is 988. While 988 is not live just yet, this is a 3-digit phone number that will be used to help individuals in crisis connect with a suicide prevention or a mental health counselor. So along with 988, partners continue to meet frequently to develop the supporting services of the behavioral health crisis response system. Our third focus area is physical activity and nutrition. The health district provided funds to Northern Nevada Hopes to stand up the 5210 Healthy Washoe program. And this is a partnership between Urban Roots, Northern Nevada Hopes, as well as Girls on the Run. Northern Nevada Hopes they're engaging their pediatric patients who are at risk for obesity. So far, they've implemented one cohort, which has been very successful. Patients and their families have attended cooking classes, learned about healthy living habits, and we're engaging in physical activity. So far, 16 individuals and their families have completed the program, and they're starting their second cohort this year. We also have an initiative around the Healthy Corner Store pilot project. This project focuses on improving access to nutritious foods in neighborhoods where grocery stores are limited. Corner store surveys were conducted with store owners to identify opportunities to improve the selections of food offered in convenience stores. So far, there are 3 convenience stores that are participating, and they're working to modify their store environment to promote healthy products. And this has also been a successful initiative, so we're moving into phase 2. And last but not least, we have the Family Health Festivals. We held 3 events last year. Each of those events had about 500 families that came out to participate. And a Family Health Festival is a hub of resources that are offered by community partners where a family can receive direct services. The 2 most needed services that were provided were mobile harvest and immunizations. So looking ahead in 2022, we're in the process of conducting our community health needs assessment, which will likely be wrapped up in the fall sometime. And then after the community health needs assessment is completed, we'll be moving towards our community health improvement plan, where we'll be engaging our community at that time. And with that, I'll take any questions.
Thank you, Rayona. Comments from the board?
Yeah, I just have one comment. We just, Monday, had some preliminary direction to City of Sparks staff to look into using some of our ARPA funds for some mental health things in the community. And I know they're looking. I don't know if there's any way to collaborate. Sometimes it's better to do what we do well all together than try to us find things. I don't know if there's any open doors there, but I just want to let you know. I'm sure that each of our regions probably have similar things that we're investing, and probably best if they all tend to flow together instead of hit it from all different ways. But just so you know, if that's something, I think Julia knows a few people in Sparks if we need to talk. But just so you know, we'd love to have conversation.
Thank you, Councilman Durr. I'll make sure that you and Julia connect on that.
Further comments from the board? No, just want to say good job, Rayona. I know a lot of the chips, things fall off, but it looks like you got everything back on track for us to start hitting some of these points. I'm sure some of these points will still be an issue as we continue the new community health needs assessment, and so, but it's a constant. So I appreciate you guys' really solid work plan, because it takes a lot of work, and it takes a lot of meetings, and it takes a lot of getting people together in a room to kind of all be hitting the same kind of goal points. So thank you for doing that. I think Dr. Clacking, did you have a comment?
No, I'll let it go. I was thinking of something, but I do not.
Okay.
Thank you.
So with that, I'll take a motion to accept the report.
Move to approve.
Second.
Motion second. All in favor?
Aye.
Any opposed? Motion carries. Move on to item 12. District Health Officer, recommendation for appointment. Any background on this?
Yes, we have Latricia Lord for this one, and yes, for appointments for our Sewage, Wastewater, Sanitation Hearing Board.
Good afternoon to the board. My name is Latricia Lord. I'm a senior environmental health specialist with Environmental Health Services, and I lead the land development team, which comprises of septic system oversight, domestic wells, and public water systems. And so as you can see from the staff report before you, we've had some resignations and expired terms on the Sewage, Wastewater, and Sanitation Board. And we've since recruited numerous qualified applicants, including a local real estate attorney. Your appointment of our recommended candidates would completely fill the Swiss board for the first time in over 10 years.
Wow.
One item of note is that when the staff report was written, we did not have a Swiss board meeting scheduled, but we've since received 2 variance requests for variances from an item of our regulation. And therefore, if the candidates are appointed today, we would schedule a meeting immediately. And I'm happy to answer any questions you have about the staff report or the Swiss board in general.
Was there a recommendation from staff or?
Correct, that's
Yes.
the.
What are the
yes.
names, I'm sorry?
Yes. Basically, the recommendation would be the appointment of Chad Carnes, Frank Pernick, Kenneth Lund, and John Adams as members, and then appoint Ron Anderson as an alternate for a 3-year term.
Gotcha. I see it now. Thank you. Comments from the board?
Good selection.
Good selection. Any public comment, Susie?
No public comment, Chair.
Okay. Can I get a motion?
Make a motion to approve, as pointed out in number 1, move to appoint Chad Carnes, PE, Frank Kernick Jr., Kenneth Lund, and John Adams as members to the SWS board, and appoint Ron Anderson, PE, as the alternate to the SWS board for a 3-year term beginning May 1st, 2022, ending April 30th, 2025.
Second.
Motion is second. All in favor?
Aye.
Any opposed? Motion carries. Thank
Thank
you.
you.
Appreciate it. Thank you, Ms. Lord. Item 13 is staff reports, program updates. Air quality. Senor Vega.
Thank you, Chair Delgado, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I would like to highlight a couple of things from my report. First, in regards to Governor Sisolak's agreement to sign on and pledge to have at least 30% of all new trucks and buses sold in the state be zero emission by 2030 and 100% by 2050. And you might ask yourself, why is that important? Again, transportation sector, medium heavy-duty vehicles such as this are a significant contributor of air pollution in Washoe County. So obviously a good thing here. Furthermore on that, in kind of some support of that, is the federal government announced $1.47 billion in competitive grants to transition older bus fleets to cleaner burning and electric buses. So again, some support in that transition as well. There's some other funding opportunities from EPA. I think $5 billion is part of the bipartisan infrastructure bill. And then also $17 million as part of a rebate program. I'll add that we continuously get these type of notifications from EPA and other areas, and we forward them on to the school district and offer up any kind of support that we can to help make this happen. So with that, I'd be happy to answer any questions.
Councilman Dare.
Just a quick question. With all that money, you said it's only for buses, but is there any finances that could potentially be used for that, our replacement car program that we're trying to lift up?
Yeah, thank you for the question, Councilman Dare. At this point, it's really dedicated towards buses and government fleets, nothing for, I'll say, emission reduction kind of programs from light-duty vehicles that we've seen anyways.
Okay, thank you.
Yep.
Further comments from the board?
Just one quick question in regards to the smoke issue that we talked about at last month's meeting and the EPA. There was a couple of us that were worried about worrying that we were going to wait till the EPA came out with its first indications, and we thought we should get ahead of that game. Any change in that thought, Francisco, at all on this?
Thank you for the question, Dr. Clacking. At this point, nothing, again, has been proposed to really comment on. Again, what we discussed last time was the Science Advisory Committee just making a recommendation to have the standard reduced. So at this point, there's no real action to comment on. The only thing I'll add is that, again, those standards are really health-based, and they're based on the most recent, I'll say, scientific and epidemiological studies. So again, those standards are made to be protective of public health. So if those studies show that those standards need to be reduced, I think that's probably a good thing. But again, once EPA makes a recommendation on that standard, that would be the opportunity to comment.
But you don't think we're going to maybe fit into that category, right? You mentioned 11 areas that were being looked at as special or something, I think. Is that correct? Does that make sense to you?
I'm sorry, I guess I'm not sure what you're
But
referring to.
it seemed like because of the basin we're in, we were talking about that, that it might be hard for us to fit into those requirements, correct?
Correct.
The new requirement.
Correct. There are concerns, obviously, with wildfire smoke and things like that. And the only thing I'll add to that is that we do submit a request every single year to EPA to exclude data from things like wildfires that go towards our compliance with the standard. So again, really focusing on emissions associated with what's happening here in our region to demonstrate compliance with those standards. So I think there's a couple different things going on there that we're obviously involved in every aspect.
Okay, maybe I confused you a little bit because you're right. It was about the wildfires I was talking about and how they would affect our conditions here with the EPA if that was going to be held against us.
Right. Okay. Any further comments from the board? See none. Thank you, Mr. Vega. Appreciate it. Item B, Ms. Lotritz.
Good afternoon again. Lisa Lotritz, Division Director for Community and Clinical Health Services. You have my report to review, and I just wanted to add, since we submitted the report, we did receive the 2020 data on sexually transmitted diseases. And so chlamydia, where in 2019 we were ranked 17th, we went to 23rd. Gonorrhea, we went from 15th to 22nd. We still were right up on top at number 1 for primary and secondary syphilis. And congenital syphilis, we remained at number 4. We think that we will probably go back where we were. In 2019, people just weren't able to get tested. And so we think, I'm sorry, in 2020, they were not able to get tested because of COVID. So we think that we're still right up there with our rankings, just weren't seeing it because the lack of testing. And just to let you know, so far this year, we've had 4 confirmed congenital syphilis cases, and last year we had 8 confirmed. So we're not even halfway, and we already have 4. So, and that's all I have, but I'm happy to answer any questions.
Comments from the board, from Ms. Lotritz?
I just had a quick question. Were those statewide numbers when you gave those rankings? Is that what it was?
Yes, those are statewide.
Thanks for that.
Thank you.
Thanks for the clarification question. I will close item B. Thank you, Ms. Lotritz. Item C, Environmental Health Services. Our 20-year vet, Ms. Dixon.
Good afternoon. For the record, Erin Dixon, Environmental Health Services. You have the report in front of you. The highlighted program this month is waste management. Gives a nice overview of the wide variety of inspections that the team does and the history of the program. I don't have much more to add. You will notice in the report, thank you for approving our Swiss board members. We are still looking for members for our Food Protection Hearing Advisory Board. And so if that application is also on our website, if anyone is, you know of anyone that would be a good candidate for that. So I have nothing to add if you have any questions.
Just one quick addition. I did talk to our city manager, and anything like that, if you're looking for someone to serve on a board from the region, we will announce it if we just send them over. He's actually would love to do that.
That'd be wonderful. We'll take advantage of that. Thank you.
Yeah. Any further comments? See none? Thank you for your report. Accept the report. Item D, Epidemiology, Dr. Dow.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So you have my report. I have nothing to change or add. A small highlight is that we're now in week 17 of our ILI surveillance, meaning that we're nearing the end of the flu season. This year's flu activities are still overall low compared to pre-COVID seasons, with only influenza A dominating the scene, but it's been somewhat more activity than what was happening last season. Recently, we've been seeing increases in flu activity since week 12, so that's since early April. And nationwide increases has also been noted. Nationally, increases in flu activities has been happening since week 6 or 7, which is towards the end of February when that's happening. And it's not unprecedented for us to see some upticks in flu activities towards the end of the season, but it's certainly not usually the typical case that happens. So the upticks nationally in flu activities did coincide with the sharp drop from the Omicron surge and the relaxation of masking and social distancing, which could have played in part to the numbers that we see. And but again, overall, this flu season is still falling on the lower end. So for those who are interested, weekly ILI reports are distributed to our subscribers, and all historical reports are kept on our website for your reference. So that's all my update. I'm happy to answer any questions you may have.
Thank you. Any comments from the board? No? Great. Thank you for your report, Dr. Dow.
Thank you.
Moving on to item E, District Health Officer.
Yes, thank you, Chair Delgado. I had just a few things I wanted to highlight on my report, and that is on April 19th, the county manager presented his recommended budget to the Board of County Commissioners, and he presented the above base requests and the budget that the District Board of Health had approved back in February. So we appear to be on track for that budget, which is scheduled to be approved by the Board of County Commissioners on May 17th. I would note that the negotiations with the labor associations are continuing, so we still do have the wild card of what the level of the cost of living adjustment will be that comes as a result of those negotiations. And then I wanted to also inform the board regarding our Title X funding. And we've been receiving funding under the Title X program for family planning services since 1970. And we had submitted a proposal for an additional 5 years of funding. We were notified on the 30th of March that although our proposal was approved, it was not funded by DHHS. And that was the day before our funding ended under our existing grant on March 31st, and it was the first that we had heard of this. Fortunately, well, let me add also that the State Department of Health and Human Services and Carson City Health and Human Services also received the same notification on March 30th for their funding. The governor, along with our state senators and Congressman Horsford, submitted a letter to Secretary Becerra to alert him of the situation and the fact that we didn't receive any notice even of not receiving funding. And we were then requested to submit a proposal, a budget for funding for a 1 year period at a reduced amount, about $500,000 versus the over $800,000, about $850,000 we've been receiving on an annual basis. So we have not received any funding yet, any notice of award for that funding. We're hoping that that comes through and that potentially there's funding beyond that 1 year for us. There's a national effort to try to have additional funds added to the Title X program. There were a number of proposals that were not funded because of the lack of funds at the federal level. But because of where we're at now and the anticipated level of funding, if we do receive the approved notice of award for the funding that they asked us to submit for, we'll still have to curtail some of our services. We've reassigned staff to vacancies that we've had to avoid needing to do any layoffs, but we're not going to be able to support the services that we've provided at the jail, the community clinics that we've been doing, for instance, at the Eddy House, the vasectomy program that we've been doing in partnership and with funding for the renowned family medicine program. The night clinics will be reduced to twice a month. We had just launched walk-in Wednesdays and done the promotion on that, and we'll have less walk-in availability. That's been just a huge success just in the initial few weeks. And we're working with the state to reprogram some of the funding that we get from the state family planning program for immunizations for those family planning clients to eliminate that immunization program and put those funds just directly to the core family planning services. Currently, the Title X funding in that program also provides us with the ability to provide contraceptive services to minors without parental consent. And so if we don't have this funding continuing into the future, then we may lose that ability as well. The governor's office and Dwayne Smith, as policy director there, have been very engaged with this and in communication with DHHS. And we'll also be, we've got a meeting set up with Chair Peters of the interim health committee for the state as well. So I think there's a lot of support that we have in trying to get this funding back for the health district, but we're kind of in this limbo period with that right now. So I wanted to have the board aware of that situation. And then lastly, we had good media coverage yesterday, held an event for the county health rankings, which come out annually from the University of Wisconsin and the Robert Wood Johnson Foundation. And so as far as rankings of counties in the state of Nevada, Washoe County, we ranked number 2 for health outcomes and number 4 for health factors. So I'm pleased to be in the top tier of counties in Nevada. That's my report. I'd be happy to take any questions.
Councilman.
Yes, thank you. I have one regarding when the laws were implemented during COVID, the regulations to our hotels. I forget the AB, whatever it was.
SB4.
That thing. I'm hearing some difficulty as we even close out, and how it's all ending. Getting off that train is going to be difficult in a lot of ways. I'd like to understand it more from our perspective, and then see if we have a role to play. And I say this, it's not necessarily a pushback towards anybody, but if we can help land the plane a little easier because of what we do and know, maybe we can be a good voice to the state, or from the state to our different businesses that are affected. But I've been hearing feedback from quite a few of some problems or some potential problems.
Yeah, maybe we can schedule something on the next agenda for a briefing. And we share your concern. It seems like SB4 is no longer necessary, and yet it remains in place under the state's law. And even some of the triggers for ending that could have done an early end of the program are not even statistics that the state is tracking anymore. So and we have been in discussions with the EHS program at the state on this very issue, and so yeah, we'll discuss this further in the next meeting and let you know the status and if there's something that the board could be doing to push for that. So.
Comments, thank you. Any further comments for District Health Officer on his report? Seeing none, with that, we'll close item 13 on to item 14, board comments. Any general comments from the board? Seeing none, any general public comments? Susie, I know we took some at the beginning.
No
I'll ask
public
again. No?
Okay, with that, we'll go to adjournment. Can I get a motion, please?
So moved. Second.
Motion second, all in favor? Any opposed? Motion carries. Thank you, everyone. Appreciate it.